It's been 5 months since his mother died, and Jack has come to see Dr. Kennett to discuss how he's been feeling. In this consultation, you can see that sharing information and options between Dr. Kennett and Jack is central to good decision-making. Dr. Kennett gives Jack the opportunity to consider relevant information that might influence his choice between the options available to deal with his grief. Understanding Jack's ideas, concerns and expectations are key to maintaining a patient-centred approach, making decisions together that would suit Jack and his circumstances in the best way. This helps them to reach a shared understanding of the expectations and limitations of the available options for Jack.
Well, it's good to see you, Jack. How are things?
Well, not too good actually, Doctor, but I was just wondering if you could have a look at my toe. It's been quite painful.
Okay. So how's it been affecting you?
Well, it's really sore and it's been throbbing, and I find it quite difficult to get my shoes and socks on for work. Ibuprofen helps a bit.
Okay, let's take a look at it. Can you take your sock off?
Consent is undertaken in 3 different ways: written, verbal and implied. What type of consent is Dr. Kennett using here? When Dr. Kennett is examining Jack's toe, he gains implied consent as Jack starts to remove his sock. Then he asks for verbal consent by saying, "Is it okay if I examine your toe?"
Well, it looks to me like it's an ingrowing toenail. I can't see any pus and it's not very red, but if you do find it gets swollen or hot or red, or you do see any pus, then please come back to see us because it could be infected. Meanwhile, here's a leaflet which tells you how to look after your nails to stop this happening again, and you might want to see a podiatrist for some antiseptic cream and nail care.
Yeah, I've been thinking about that. There's a place down the road that I might book in with actually. Thank you for this leaflet, I'll have a read.
So, how are things in general, Jack? You said that you weren't feeling too great.
Yeah, well, things aren't brilliant.
Oh, I'm sorry to hear that. In what way?
I've just been feeling a bit down, really.
When did you start feeling like this?
It was gradual, it's sort of crept up on me. My mum died 5, nearly 6 months ago. And it was just so hard towards the end. But I got through it, and now I'm handling all of her affairs. And last month we found a buyer for the house.
Well, I'm sorry to hear about your mum. Must have been very difficult to sort out her affairs on your own.
I keep thinking that I should be feeling better. It's been 5 months, but nothing seems to be improving.
Well, there really is no time limit on these things, Jack. Everyone is different. You know, sometimes you start to feel better and then something sparks it off again, like selling your mother's house.
Yeah, it was so sad. It's just so hard because we lived there together, me and Mum, for such a long time, and all of our family things are still there.
Remind me, do you have any family nearby?
No one close, no. There's my mum's sister and my dad, but he lives in South Africa. Although, I mean, him and my mum had been separated for more than 20 years, so I guess it was just me and Mum for a really long time. And my mum's sister lives in Scotland, so I don't really see her.
So you have been dealing with all this all on your own. Jack, tell me more about how you've been feeling. How's your appetite?
I mean, I'm okay, I'm getting by. I just think about Mum every day. I really miss her. My appetite's gone, so I don't really do much cooking at the moment. To be honest, I'm having ready meals most evenings. And I don't tend to bother with breakfast or lunch. I just don't feel like it.
And how are you sleeping?
I find it quite difficult to get off to sleep. My mind's buzzing. And if I do get off to sleep, I'll wake up around 3 a.m. and be wide awake and won't be able to get back to sleep.
How are things at work?
Well, I've got my final assessment for my apprenticeship in a couple of weeks, but I've been finding it quite hard to concentrate, so I've not been studying, and I'm a bit worried that I'm going to fail. I am still dragging myself into work somehow, but when I get there, all I think about is going home, and when I get home, I remember about Mum and all the things I've got to do, and it all feels like too much.
Of course, you are missing your mum, and there is a lot on your plate. Jack, are these your main concerns? Feeling low because of missing your mum, your loss of appetite?
Yeah, I suppose so.
Jack, are you still enjoying the kind of things that you did before, like socialising with friends, for example?
Sort of. I just can't face doing anything. My friends will text me and I'll make excuses as to why I can't go out with them.
Well, I'm glad that you came in today to talk to me about this, Jack. It sounds like you're having a tough time.
It is important for Dr. Kennett to clarify how Jack is feeling during the consultation to ensure that he can base specific advice and treatment on his individual needs. For example, to assess his risk of self-harm or how he's sleeping and the effect on his nutrition and work. For GPs, it is important to explore these difficult issues. In the next few sections, we'll look at a couple of alternative scenarios and how to handle these. In the first one, Jack will reveal thoughts of self-harm.
Well, I'm glad you came in today to talk to me about this, Jack. It sounds like you've been having a tough time. Jack, sometimes when we're feeling low, we may have thoughts about harming ourselves, maybe even ending your life. Is that something that's happened to you?
Well, to be honest, I've been feeling quite desperate sometimes. And the other day I was driving my car and I just started imagining what it would be like to drive on the wrong side of the road and smash into another car.
What actions would you need to take in this situation? We know that more men commit suicide than women, and it is important to check that Jack gets some urgent support.
You know, Jack, sometimes when we feel low in mood, we may feel like harming yourself, maybe even ending your life. Is that something that's happened to you?
Oh, no. I want to feel better and get through my exams and everything.
Oh, that's good to hear. So, Jack, have you thought about what support you might need?
I was wondering if you could prescribe me some tablets, just to make me feel better in the short term. Someone else that I work with takes them and he said they're really good.
How would you deal with this situation in which Jack wants a prescription for tablets, but you don't think this is the best solution for him at this moment? Although Jack would like to have medication to get his life back to normal, Dr. Kennett needs to discuss with him the other ways of managing his situation that may help. It's important to discuss all the options with him and what the evidence shows about taking medication.
You said that you're low in mood, have difficulty sleeping, with poor motivation and concentration. Grief affects everyone differently. It takes time to feel better, but it sounds like it's impacting on your mental health.
Yeah, I think you're probably right.
Well, there are a number of options available, including antidepressants. The options have different benefits for different patients in similar circumstances. And if it's okay, let's talk them through together so we can decide on which one is right for you right now.
Yeah, okay.
Good. Now, some bereaved people find talking about their feelings and thoughts can be helpful. Is that something you've considered?
No, not really. What would that involve?
Well, I'd need to share some information about you, including today's consultation with our bereavement counselling service, if you're okay with that.
Yeah, that's fine by me.
Then they would contact you and organise a session for counselling. Also, there are voluntary services which specialise in grief counselling over the telephone. They can sort out a talking session with a trained professional. I can also give you websites with lots of useful information for people who are going through bereavement, same as yourself. And there are local support groups where you can talk through your experiences and maybe even share coping techniques. Now, you said that you're worried about your exams. So why don't you talk to your tutor and ask him if there are any kind of available support? You may also be able to delay them for a while.
Yeah, okay, but wouldn't it be better just to get some medication so I can feel better quickly and get through my exams and the house sale and everything? It's just that I've heard that counselling doesn't work very quickly.
How would you answer Jack's question about counselling not working? Grief counselling has shown to be very effective.
Well, everyone is different, and the options work differently for different people. Sometimes a combination of options is needed. It is important to keep an open mind and to give it time. Counselling has worked for many people in your circumstances. It's worth a try.
Yeah, okay. But you're not saying no to pills in the future if the counselling doesn't work?
No, not at all. We can meet again in a week to see how things are, and we can review the options again. Meanwhile, other things can help. Do you exercise much at the moment?
Well, I play five-a-side football, although, to be honest, I haven't really been going much this season. I've just not really had the energy.
What about starting again?
Yeah, I could do.
Okay, and Jack, this is something that we have to ask all our patients. Do you drink alcohol or take drugs?
Oh no, I don't take drugs, and I don't really drink much anymore either.
Okay, that's great. And have you actually talked to anyone about how you've been feeling?
I have spoken to one of my friends, Charlotte. And she was really helpful to start with, but, well, she's got her own problems and I don't want to be a burden. Oh, and I had to tell my boss at work last week. That was so embarrassing. I'd been going in late and he was threatening me with a formal warning. I felt awful, like I was making excuses or trying to make him feel sorry for me or something. Although he was a lot nicer to me after I told him about Mum.
That's good. It would be useful for your boss to know about the kind of pressures that you're under. He may be more understanding in the future.
What safety netting do you need to put in place before the end of the consultation if Jack is feeling worse mentally? Safety netting would include specific instructions of how Jack can access Dr. Kennett again and details of other support services in case he is not available. Safety netting needs to include specific advice about what to do if he begins to experience a deterioration in his symptoms.
Is it okay if we meet again soon, Jack?
Yeah, sure.
Okay. I'll get reception to make an appointment. Hopefully you'll be in touch with the support group by then and you can tell me how the exercise is going. Now, if you need to speak to me in the meantime, just ask for a telephone consultation. I try to have a few of those most lunchtimes. This is especially important if you're feeling any worse, like having darker thoughts or feeling more hopeless. If you are, then tell me or another doctor as soon as you can. I have a leaflet here that gives you numbers of emergency helplines, such as 111, for when the surgery is closed. And accident and emergency is a safe place that you can go to. There's always a psychiatry team that can talk to you.
Okay, thank you.
So Jack, can you talk me through our plan of action, just so that I can make sure that you understand what we have agreed together?
Yeah, sure. So you don't think that tablets are the right choice for me at the moment, but we'll talk about it again when I see you in a few weeks, if I'm not feeling any better. Until then, I need to look into joining a support group, and you're going to refer me for counselling. I also need to make more of an effort with exercise, read these leaflets, and what was the other thing? Oh, look at the websites as well. And then, yeah, I'll see you again in a couple of weeks. But if I feel any worse before then, I should give you a call or call one of the numbers in this leaflet.
Okay. And does that feel like the right plan for now?
Yeah, I think so, yeah.
Jack, remember you're feeling grief, and it's hard, but it's the normal kind of thing that you need to go through. We'll work together to help you feel better, and with support, things should improve.
Okay.
Come back and see me in 2 weeks, and depending on how you feel, we'll see where we go on from there.
All right, great, thank you.
Okay, well, take care of yourself, Jack.
Thank you, Doctor.
A consultation like this one with Jack can be stressful for the doctor. It's important that the decision-making process is shared between the patient and doctor, and that the patient is supported to understand what their treatment options are and what the likely outcomes will be. They are then more likely to follow the advice and guidance provided, as they understand the reasoning behind it and have been fully involved in deciding what's best for them in their situation.
I remember Dr. Kowalski mentioning Mrs. Thomas a few years ago. She was supporting her after a diagnosis of breast cancer. We talked about how young her son was in dealing with his mum in the hospice. He seemed to be without much support. We chatted about what we could offer him and his mum. I haven't seen Jack since. Patients with low mood after bereavement often request medication to help them feel better. I think it's important that patients know about other options and the research which shows that with antidepressants, psychological support such as counselling helps recovery. I find patients who access help early can prevent long-term problems. Also, his mum only died 5 months ago, and it's likely he's experiencing normal grief reaction. Patients understand if I explain why I recommend one option over another, and why the option they may want is not necessarily going to have the outcome they're after. It's about shared decision-making and honesty about the pros and cons of each option. GMC guidance says that the doctor and patient consultations should be a partnership towards shared understanding of what we expect each option to achieve, given the patient's individual circumstances. As long as I explain my reasoning and tell patients about the alternatives, I can recommend a particular option for treatment, which is what I did today with Jack. The follow-up will be useful to see how things are going for him, and if he's still not feeling any better, then we can look at the options again. I was aware of the importance of safety netting in this situation in case Jack begins to feel worse, including agreeing on a crisis plan if the practice is closed.
Well, that wasn't what I was expecting when I went in about my toe, but I felt okay about it. And it was good to talk, actually. Even though Dr. Kennett didn't prescribe me the tablets that I'd asked for, he did explain why. I hadn't realised that just talking could make people better. But Dr. Kennett said that counselling is even more effective than tablets for some people, most people even. And he also explained why the tablets wouldn't be the quick fix that I'd wanted. So even though counselling wasn't what I wanted at first, I can see now that it's probably the best thing for me at the moment. And Dr. Kennett was really supportive, and we talked about some other things that might help too. That was a good idea about finding a support group. It won't feel so weird talking about mum with other people that are going through the same thing. And, well, I won't have to worry about putting a downer on the conversation when that's exactly what we're all there to talk about.
Dr. Kennett documents the consultation. This becomes important if Jack sees another member of the healthcare team to ensure continuity of care. Early next week, Jack calls for another appointment for his infected toenail. He is having difficulty walking. The receptionist makes an appointment with the physician's associate, who has a clinic that day.
Hi Jack, I don't think we've met before. My name's Eunice Ashley, I'm a physician associate here. How can I help today?
Hi, it's my toe. I've had this problem before. It's really quite painful. The doctor last time said that I should come back if it doesn't get any better because it might be infected.
Oh, okay. Do you feel unwell at all?
No, I don't feel sick or have a fever or anything. It's just my toe. There was yellow pus coming out of it this morning.
That sounds painful. Are you happy for me to take a look?
Yeah.
What type of consent is Eunice using? In this case, just verbal consent is used. Remember that Jack can withdraw his consent at any time before or during the procedure.
So do I need antibiotics then?
Yeah, that's looking quite infected. I'm just going to need to arrange a prescription for you. It means I need to pop next door to speak to the GP. Are you allergic to anything?
No.
Okay, and can you take ibuprofen?
Yeah?
You don't suffer with any reflux or heartburn?
No.
Fantastic. If you take the antibiotics and after a few days and take some ibuprofen as well, you should notice an improvement. If it's not or it's getting worse, do come back and see me, okay?
All right, thank you.
Great, okay. Before I go, I can see that you saw Dr. Kennett last week.
Yeah.
How's everything going?
Well, I've been feeling a bit down, and so I talked it through with Dr. Kennett and we came up with a plan of action for me. I initially wanted some tablets, but in the end we agreed that I'd try exercise and some counselling.
Okay, that's good. And how's that?
Yeah, pretty good. I think I feel a bit better actually, just from having talked about it and knowing that there's a plan in place. Although I'm not sleeping any better. I told Dr. Kennett I wake up in the early hours and I can't get back to sleep. I don't know how I drag myself into work some days, and I had to take time off to come here today, and I don't want to lose my job.
Oh, it must be quite worrying for you. Have you spoken to your boss about it?
Yeah, I have, but his patience will run out, I'm sure, if I keep being late and having time off.
Have you tried podcasts? Sometimes listen to podcasts when you're going to sleep, or in the early hours when you wake up. It can feel quite lonely, but listening to someone's voice can help. There's a couple of mindfulness apps that I can show you. Have you heard of that before?
Yeah, I have heard of it, but I don't know much about it. Does it work?
For some, and if it doesn't, then there are other options. There's sleep hygiene. So that's things like leaving your phone outside of the room when you're going to sleep, making sure that it's pitch black when you go to bed. Sometimes even writing your thoughts down in a notebook can be helpful.
Okay, yeah, I've heard of some of those things.
Okay. And Dr. Kennett said that he referred you to the counsellor last week. Have you heard anything?
No, not yet. Dr. Kennett said I should go back and see him, so I've got an appointment at the end of this week to talk through the options again.
Okay. I haven't been through all your notes. Is there anything in particular that triggered this off?
Yeah, my mum passed away about 5 months ago of breast cancer, and it fell to me to sort out all of her affairs. I mean, Mum, bless her, she did try and sort some of it out before she went because she didn't want me to have to do everything. But anyway, last month I found a buyer for the house and it's just been really stressful. To be honest, I felt quite lonely. I've not really had anyone to talk to about it, and even though my friends were really supportive after the funeral, we've all gone back to our own lives now and I'm just left.
Oh, I'm so sorry to hear that, Jack. It can be quite normal to feel quite low and have difficulty sleeping when these things happen. If you ever want to come and talk to me about it, or then we really don't mind who you see. You can book an appointment to see myself as you did Dr. Kennett. It's not a problem at all.
All right, thank you.
Okay, let me go and sort out the prescription for your toe. It was good to meet Jack today to talk about his immediate clinical presentation of an infected toenail, but I used the opportunity to also discuss his mood. It was useful to have the notes to be able to see what had happened previously. It's important to acknowledge that other things that are going on in a patient's life that may affect their mental health may also impact their ability to deal with their physical problems, even something as small as an infected toenail.
Well, that was interesting, seeing someone else at the medical centre who could deal with my problem. The receptionist suggested talking to Eunice, and she managed to get me an appointment the same day. Eunice was able to look at my toe and figure out what the problem might be. We also had a chat about how I'd been feeling and about my mum, and that was nice, actually. It's good to know that there's someone else there that can support me. I will go and see Dr. Kennett at the end of the week, as planned, but I think next time I might book in with Eunice, because she was really easy to talk to, and she suggested some other things that might help as well.
A physician associate is a health professional who runs their own clinics in the medical practice under the supervision of a GP. Physician associates are really valuable members of the team and can deal with a huge range of problems, as well as manage other tasks in the practice, such as looking at incoming pathology results and hospital letters, conducting telephone consultations, and responding to online queries.
As a physician associate, I'm part of the clinical team within the practice. I have my own clinics under the supervision of a GP where I see a variety of things, sore throats to chronic conditions such as asthma and diabetes. If there's a problem outside of the practice with some of our patients, then I can also do home visits. During the day, I might also look at blood results and also any letters that come through from the hospitals. I attend meetings, and these can include with other healthcare professionals where we talk about patients perhaps with cancer or safeguarding issues or complex medical needs. As part of the team, I also attend educational meetings. As well as being an extension to the clinical team, I also provide support for the non-clinical staff, and I'm an extra pair of hands to help continuity of care for our patients. I really enjoy being a physician associate. I really value the relationships that I build within the team with my supervising clinicians, as well as the relationships I build with the patients. I also really enjoy problem solving, trying to work out what's going on and really making a difference to patients.